listeners. Thanks for tuning into The Spark, Medical Education for Curious Minds, where we present the people and stories behind medical advances at UCSF, including those led by medical students, physicians, and faculty in the School of Medicine. Through The Spark, we share the innovations at UCSF that are helping bring more equitable and better care to our communities. I'm Karen Fleming, Communications Manager for the Office of Medical Education.
And I'm Greg Gadwood, Instructional Designer for the Technology Enhanced Education team.
In this episode, we feature initiatives in the School of Medicine focused on diversity, equity, and inclusion, both in approaches to patient care and research, as well as in medical education via the Bridges curriculum. We'll hear from Dr. Michelle Guy, a professor of medicine and a Dean's Diversity Leader in the Differences Matter initiative, as well as a second-year medical student, Daniella Cordero, who has been instrumental in activism around gun violence prevention, white coats for Black lives, as well as gender and health equity. Both interviews give context to how the School of Medicine is building the most equitable, inclusive medical school nationally. So I'm here with Dr. Michelle Guy, who is a professor of medicine, Dean's Diversity Leader, a Bridges coach, and Director of Diversity for GME at UCSF. Dr. Guy, could you tell me a little bit more about your role as a clinician educator at UCSF?
I really enjoyed being here at UCSF for the past 14 years. As a clinician educator, I get to see patients in the clinic as well as work with learners, both residents and medical students in the clinic, as where they see patients and then get to precept them in the clinic.
What sparked your interest in initiatives aimed at incorporating diversity in patient care and medical education?
Yeah, so as a Black Latina immigrant from Panama, I grew up in St. Louis when I came to the United States, and I lived in San Francisco for about a year before I went to medical school. I actually lived over on 4th and Parnassus for about a month, and so UCSF was always sort of a beacon for me, and finally got to come to UCSF as a faculty member. And so one of my first things that I really wanted to do, and part of the reason for coming is to really try to change that dynamic of thinking about how we can be more inclusive of minority students, as well as just in general working on diversity, equity, and inclusion. And so that's been more recently a lot of the work that I'm doing here at UCSF.
You have a unique distinction as a faculty member in the School of Medicine, having roles working directly with students in undergraduate medical education as a Bridges coach, with residents and fellows as part of the GME group and the Director of Diversity, and as part of faculty initiatives as a Dean's Diversity Leader. What are the overarching themes in these three areas?
So recruitment and retention of diverse students and residents and fellows, and then getting them into faculty positions to reflect the diversity of our patient population is one step towards mitigating health disparities. Another one is understanding our differences and other people's perspectives, and knowing how we're different and being able to talk about our differences, as well as understanding others who are different than us, I think is an important part of the trainings that we do, especially for faculty.
What have you observed or helped lead or develop yourself at UCSF as some of the most promising changes to come about recently in these areas?
I was one of the inaugural Bridges coaches in the first group, and now we're preparing for our third class to come in of Bridges students. And I was so impressed by the extent to which the curriculum has really been revamped to incorporate health equity, social determinants of health, and diversity, equity, and inclusion. I already mentioned the Differences Matter orientation as one of those threads. There's also a day-long course in the Foundations 2 that the students do on structural competency. And I've also seen how the faculty is working really hard to incorporate diversity, equity, and inclusion into all aspects of the curriculum, from how cases are built and the types of patients who we represent in cases, to training our standardized patients, to also adhere to some of those diversity, equity, and inclusion principles. The other exciting things I've seen are the clinical reasoning realm, exploring bias, and how it impacts our quality improvement projects in the clinical microsystem. My colleagues in the Differences Matter, Dean's Diversity leaders are also doing some amazing work building health equity toolkits for patient care, as well as creating health equity advisory board and collaborating with UCSF Health to create a health equity advisory board. So that's some exciting work being done by others. And then personally, I've been involved in creating a handbook for holistic review and GME with a group of 7 other faculty and trainers. We're doing faculty training in diversity, equity, and inclusion. And our hope is to train 1,000 faculty by the end of this year.
Now that we've heard from Dr. Guy about her roles in Differences Matter and the diversity initiatives in undergraduate and graduate medical education, let's hear from second-year medical student Daniella about how elements of the Bridges curriculum are helping learners understand the social determinants of health, the need for greater healthcare equity, and how students, as future physicians, can prepare to care for patients from diverse communities. Daniella, what sparked your interest in initiatives aimed at incorporating diversity, equity, inclusion in patient care as well as in the School of Medicine community of learners?
If I'm being honest, I think my entire life up until this point has shaped and pushed me towards this work. I'm a queer woman of color pursuing a career in a world that was not built for me. And I can recognize that it's a lot easier for me than it was for people before me, but I still think that we can push to make it better. And I think when looking at this from a patient care perspective, the motivation feels even more obvious. We know that patients with diverse care teams have better outcomes. We know that we can provide more patient-centered care when physicians reflect their communities, so we need to work to improve it.
What are the overarching issues in this area in the context of patient care and research and in training medical students to care for patients or conduct research?
1, oppressive social structures exist. 2, these structures negatively impact health and health care. And 3, we as healthcare providers have the power to help dismantle these structures. UCSF School of Medicine, and the Bridges curriculum in particular, places a lot of focus on addressing the first 2 issues, and I think we are truly ahead of the curve in that respect. Where I would love to see us and our peer institutions push even further is on the 3rd point. We can and should teach students to identify structural oppression and its downstream effects on health, but we also need to equip ourselves with tools to combat it.
I wanted to talk about some of your work in the School of Medicine around issues including gun violence, gender and health equity, white coats for Black lives, and then a little bit in terms of the curricular nature of the program, specifically the health in the individual block.
So with respect to gun violence, I'm an alumnus of Marjory Stoneman Douglas High School, which was the site of the February 14th Parkland shooting. In the days following the shooting, I remember watching the mobilization of MSD students and alumni, and I realized that my fellow classmates also recognized the depth and breadth of this problem. Together, we figured out how to brainstorm using our unique strengths as medical students to advocate for gun violence prevention. We teamed up with community-based gun violence prevention organizations, including the SF Brady Campaign and Moms Demand Action, as well as various student groups across the UCSF School of Medicine, the School of Nursing, and the Graduate Professional School to organize a White Coats Against Gun Violence movement centered around a clear message. Gun violence is a public health issue, and we, as current and future healthcare providers, have a duty to address it. By banding together as a community, we were able to harness the media's attention on a single mass shooting in a fairly privileged neighborhood and draw the connections to a much larger epidemic, one that is deeply shaped by the forces of structural oppression. Together, we could highlight the fact that gun violence disproportionately affects communities of color, that police violence is a form of gun violence, that in the United States a woman is shot and killed by a current or former partner every 16 hours, and that guns shift the probability that a suicide attempt will result in death from 3% to 90%. We can't have a conversation about diversity, equity, and inclusion without acknowledging these forces. Overall, my first year in UCSF has been inspiring and empowering, and the White Coats Against Gun Violence movement played a huge part in that. This institution has supported and fueled my passion for advocacy in medicine, and I'll be a better physician for it. I'm also part of White Coats for Black Lives, which began here at UCSF back in December 2014 in response to the injustices in the cases of Michael Brown and Eric Garner. Medical students recognized racism and police brutality as public health issues, and they took a powerful stand against it. Whitecoats recently published a racial justice report card, wherein we evaluated participating schools on their academic center's curriculum and climate, student and faculty diversity, policing, racial integration of clinical care sites, treatment of workers, and research protocols. It's difficult to understate how important this work is. The Racial Justice Report Card sets rigorous standards for top institutions to ensure that outward commitments to work around diversity, equity, and inclusion translate into measurable outcomes for students, staff, faculty, and most importantly, our patients. The 2018 report card highlighted that most top institutions still have a long way to go. Importantly, this is not and should not be surprising. We can be proud of how far we have come and still push to do better. And the response by the UCSF administration directly supported that notion. I was so impressed by the dean's response to the report card. They took us seriously and were quick to set up a meeting with Whitecoats for Black Lives. From that meeting, we have set up working groups with each dean to figure out how we can rise above that baseline and always fight for a more just and equitable world for our patients.
So you touched upon this in your response, but anything you didn't mention in terms of what you've observed at UCSF as some of the most promising advances in delivering more equitable care, or leading more equitable research, or student-related initiatives to consider the social determinants of health when considering the future treatment of patients?
Some of these commitments in shaping medical education and in taking the way in which we train the next generation of doctors and training them to see health inequity as a health crisis and as something that we need to respond to as physicians is exactly where we are pushing that envelope forward. And I think that comes through in UCSF's support for student advocacy, support and response to groups like Whitecoats for Black Lives. We also see it in the Bridges curriculum. We have the health and society block as well as the health and the individual block within our preclinical curriculum, which is dedicated time within an already compressed structure that allows us to explore how identity and structural forces and oppression shape our patients, shape ourselves, and shape the way in which we interact with each other and provide that care. And so I think that as we continue to respond to students and push medical education and the entire field of medical education in the United States forward in these respects, we will be creating a workforce of physicians that will help fight for a more equitable world as we move up through the ranks of medicine.
Let's take a step back for a minute and put this in context. From the interviews with Dr. Guy and Daniella, I'm struck by the impact of initiatives such as Differences Matter, also Whitecoats for Black Lives and diversity trainings at UCSF. How is the school moving these areas forward, and what has been achieved so far?
Collaborative work between Differences Matter, UCSF's Office of Diversity and Outreach, and Whitecoats for Black Lives is underway. This will address both structural racism and interpersonal biases that contribute to inequities in healthcare for patients and the education for students. These collaborations have already resulted in things like full-day training workshops on equity, inclusion, and bias, new student competencies focused on equity, inclusion, and the elimination of healthcare disparities created by Whitecoats for Black Lives students and members of the Dean's Diversity Leaders, and a committee focused on supporting educators to engage in equity pedagogy created by the Academy of Medical Educators. Other measures that have taken on diversity and inclusion issues at UCSF include a new medical student orientation that challenges students to commit to addressing healthcare disparities by learning about equity, inclusion, and bias. Dr. Guy explains more about some of these initiatives as we hear in the following segment.
So in student training, we have a Differences Matter orientation that we do for the Bridges students when they come in. And that theme of health equity and inclusion is starting to be threaded throughout the curriculum for students. I think for our GME learners, our residents, and our fellows, that theme of diversity and inclusion, we are also putting into a holistic review handbook that we created and thinking about as program directors and program leadership, how then we create also an inclusive environment for our residents. And then lastly, for faculty, we have a diversity, equity, and inclusion champion training that helps them think about differences and how to work with diverse learners and how to recognize microaggressions and mitigate them.
After learning about faculty and students' commitment to diversity, equity, and inclusion, I'm inspired by how the School of Medicine is building the most equitable, inclusive medical school nationally. Be sure to tune into our next episode in which we explore new advances at UCSF focused on treatment for chronic pain.
Music in this podcast comes from Poddington Bear's Egress, licensed under CC BY NC 3.0, and available at the Internet Archive.